My name is Chizo. I'm here to administer my medication, my 9 o'clock medication. And before I do that, I will go and pick up my MAR and the codex in the nursing station. Okay. Right here in the nursing station, I have to cross-check with my MAR and the codex to make sure that all the medication that I have is on hand. So right here, I have 4 medications to give to my clients or to my patient. Right here, I have Calyx, I have Procademic, I have Adderall, I have potassium. Okay, and I have seen that all the medications are correct. So if there's any discrepancy, I will still go ahead and check on my doctor's order. Since there is none, so I'll go ahead and go to the medication drawer to pull my medication. Okay, right here on my, before I get into the medication drawer, I also have to check on the right medication, right route, right time, right date, and right patient. So I have to check the 5 routes before I start getting my medication from the drawer. Now in the drawer, I'm going to also cross-check. This is the second check that I have to do on my medication that I have to give. I'll go ahead and cross-check with my MAR and my codex to make sure that all the medication that I have here is in my drawer. Right here, I'm going to pull Careflex, which is medication for antibiotic, is for bacteria. I have 250 milligrams, and this is 250 milligram Calyx, and I cross-check it with my MAR. It's the same amount. Also, I have Adderall, 500 milligrams. The Adderall is for hypertension. So I'm going to get the Adderall. I'm going to put it in the cup. Okay. And I'm going to check off that I have full Adderall. And I'm going to put my potassium. I'm going to do the same. And check off the potassium. I also have some PRN medication. I have makeup magnesium, I have Tylenol, I have albuterol for inhaler, and I have Restore, which is for lack of sleep, insomnia. Then after that, I will take my medication to my patient room to deliver, to give my medication. I'll take my medication with my MAR and water. Okay. Before I start giving my medication, I will go ahead and wash my hand, do my hand hygiene. Then I'm going to step into the patient room. My name is Chizo, and I'm here to give you your 9 o'clock medication. I'm going to be your nurse today. What is your name and your date of birth?
My name is Sophia Ibeneme, and my date of birth is 2/6/1958.
Okay. So I have to check my patient name band to make sure that I'm giving the right meds to the right patient, and she's the right patient. Now I'm going to go ahead and give my medication, and I'm going to let her know the medication that I'm giving to her today. Since she has pneumonia, she's going to take an antibiotic. Before we start giving the medication, I'm going to ask my patient to see if she's going to take all the medication at the same time or if she want to take it one at a time. So Miss Ibeneme, would you like to take all your medication at the same time or one at a time?
At the same time.
Okay. So right here I have Calypso, which is for your antibiotic. I have 250 milligram, and I have Procadim, Procamed, Procamed, 500 milligram, which is for your ventricle construction. I have Adderall, which is for your hypertension, and I have the potassium. Since this patient, since Mrs. Beneme is taking medication for hypertension, I will also assess for blood pressure. So I'm going to take her blood pressure before I give her her medication. So I'm going to give her her medication. Here's your medication, and here's your glass of water. Okay. All right. Now I'm going to watch her to take her medication, and she did. Then the next thing I'm going to ask her is, are you having any pain, Miss Ibeneme?
No.
Okay. You having any shortness of breath?
No.
Okay. If she's having any pain, I'm going to ask her from 1 to 10 to give me the level of her pain. Since I have Tylenol as one of my PRM medication, and I'll go ahead and give it to her, but meanwhile she's not having any pain. Also, I have the milk of magnesia, which is one of my PRM medication. I will also give it to her if she's having some constipation. Mr. Benjamin, are you having any constipation? Okay, how does your last stool look like? Is it hard or soft? Okay, so I don't need to give her any milk of magnesium, since milk of magnesium is for softening her tools. So she's okay. But I'm going to ask her also, are you having any shortness of breath? Okay. I also have the albuterol here, inhaler, 2 pumps, and she says she's not having any shortness of breath. If she's having, then I'm going to give her 2 pumps of albuterol. So, before I leave, I'm going to make sure that Miss Benjamin is comfortable. I'm going to put the bedside red oil. I'm going to put the car bed and ask her to call me when she needs any assistance. And I'm going to go back to the nursing station and do my hand hygiene and do my documentation in my mom. And that is my oral medication. Ugo.